Welcome to this webinar on improving your core and pelvic floor. I am so excited to have you here learning with me today. So this webinar is specifically designed with two purposes in mind. So purpose number one is to provide a breadth of knowledge for professionals, but provide it in a very self-exploratory way. So let me explain. I feel like we have a gap in the industry for helping professionals who are trying to deal with their own issues. All right, so we have continuing education courses that are great, but they often don't offer personalized support and help with troubleshooting. And then we have programs or in-person care designed for individuals to help with that sort of stuff, but you only learn what directly applies to you. So you can't take that little tiny slice of information and apply it to helping a wide range of people. So in light of that, we are starting a program for fitness and health professionals to feel safe working through their own issues, because we all have issues that we work through. So I was one of those people that had to fight my way through my own healing because I was having a hard time finding help. So we'd like to support you in your journey, but also wrap it up into a bigger picture kind of learning experience. So our goal is to create the best of both worlds, and I'm so excited about this, where you get support for working on yourself while learning and earning continuing credit. Now, purpose number two for this core and pelvic floor webinar is not only to provide exploratory education, but also to continue analyzing what we can control, what we can improve in the human body, and to get some of that knowledge out there. Right? We already have the simple approaches to things like exhale on the hard part, do Kegels, don't do Kegels, just do a full squat, get release work, that'll fix all your problems because your entire issue is tension, which, you know, in some instances it's true and is great advice and works. And in context, simple advice can be awesome, but what about that other 20%? What about the people who that simple advice doesn't work for? It doesn't do the trick for. All right, what about that person still having nagging hip pain or leaking when they max out and they've tried all the simple advice? Or those who still feel like their abs are distended despite doing all the core work. So I often find that many of us in the industry end up with the most complicated cases. And I feel like that's because we often push our bodies harder, all right, than the average person might. So, I mean, who doesn't love a really good workout? We went into this because we love exercise, but also because we do know something, we will tend to layer on compensations that make things much more complicated in the end than working with the average person. All right, at least that's what I've seen. So I've spent the better part of a decade getting to work with lots of fitness and healthcare professionals, from personal trainers, Pilates and yoga instructors, all the way to fellow PTs, OTs, and chiropractors. So it often presents me with the most complicated puzzles where we've got to peel back lots of layers to figure out what really needs to be addressed. So in other words, the simple advice just doesn't work. All right, so let's dive into the core and pelvic floor a little deeper and take a look at strengthening your lower abs, improving leaking, and decreasing posterior pelvic floor tension. So I want you to have some fun, all right, while we spend time learning together, going through this process. So one thing that amazes me is how many of us take courses, take continuing education classes, learn the exercises, but never really give them a full try on ourselves. All right, so I am going to need you to join me for this to make sure you can really feel what's happening in your body. All right, so go ahead and get ready and join me on the floor for our first exercise. So our first step along the way to improving our pelvic floor contraction, decreasing posterior tension, and helping those lower abs fire better is going to be a little bit of a particular muscle contraction. So what we want to think about with that is finding hamstrings without a lot of clenching. So let me explain, and you may have heard this before, but have you actually tried it? So I want you to join me. So go ahead and find somewhere where you can sit comfy on the floor and place your feet up on, like if you're at home, place them up on your couch or anywhere like that. This makes for an easy position to find those hamstrings. So the reason we want to find hamstrings is because hamstrings attach to our ischial tuberosities, and I like to think of them as acting like anchors for our pelvis. So they're helping to pull down or posteriorly tilt the pelvis. Now, the kicker here is that a lot of times we'll kind of group everything together. We'll squeeze our glutes while we contract our hamstrings. So it's just all posterior chain, which is fine if everything is working exactly like it should. Then there's no problem. But if you're dealing with maybe leaking or your lower abs aren't responding like you want, then we want to look at separating out that contraction to individually strengthen the proximal attachment of the hamstrings before we layer on the glutes. So then it comes down to a matter of timing. And a lot of times this is what's happening in the body, right? It's just the timing at which our muscles are showing up, which then dictates how things feel. So we really want to just take a minute, take a breath, and kind of feel our way through these things to really get great results. So we're going to find those proximal hamstrings, and we're going to think about keeping that tailbone heavy, and I'm going to have you physically pull on that area in a minute. And I hope you feel how as you pull up on those ischial tuberosities, you feel some space being created here by your tailbone. You feel that sacral nutation happening. You feel that opening of that space. So I want you to follow along and give that a try with me. So that's going to be our first step that we want to accomplish. So go ahead and join me on the floor, and let's see if we can find our proximal hamstrings. So in order to really think about that, I want you to think about the distal hamstrings first, right? So our hamstrings insert here behind our knee, okay, and go all the way to our ischial tuberosities. So when we think about pulling on these distal hamstrings, we think about bending the knee more, right? And our hamstrings can even act as drivers for our tibia. So if we have an imbalance in our hamstring contraction, meaning like more lateral hamstring, less medial hamstring, then we might want to turn our foot out a little bit. We might end up more with hamstring strains because we're overloading this biceps femoris a little too much. So when we think about that hamstring, I want you to also note your foot direction when your foot is up on the surface. So if you notice your foot is wanting to turn out, let's turn that foot back straight, because think about that as your hamstring driver. And we really want that nice even contraction throughout our hamstrings so that everybody is pulling weight so that we don't end up with a strained hamstring. All right, so because the biceps femoris is the most commonly strained hamstring. So it makes sense, right? So what I want you to think about doing here is think about bending your knee more as you lift. So if your finger were behind your knee, you were going to pinch your knee. And I just want you to hold that for a minute and see what you feel. I don't know about you, but I do not feel anything happening here in my proximal hamstring area. I feel a little bit in the middle of the hamstring belly, and then I feel it happening behind the knee. That is distal hamstring. That is when I ask people to engage their hamstrings here, which then lifts their hips a little bit. That is the most common place I see it come from. That does not help us at all for our purpose of improving our lower ab strength and freeing our sacrum and decreasing that posterior pelvic floor tightness and improving leaking. Okay, doesn't help us at all. We need proximal hamstring. So what I want you to think about here, take your hands and place them right above your ischial tuberosities. So find your ischial tuberosities, go right above, so closer to the ceiling. And I want you to think about pulling your ischial tuberosities open a little bit and then lifting them up. Okay, so what I'm doing here is I'm taking my hands on my ischial tuberosities, I'm pulling them open a little bit, and then I'm lifting them up toward the ceiling. All right, so go ahead and do that for me. So hands there, pull them open and lift up. Now I just want you to hold that position. So really do as much work with your upper body as you can so you're really kind of pulling into this. Now I want you to see what you feel. Do you feel how the space around your tailbone is opening? Do you feel how the pelvic floor, posterior pelvic floor is lengthening a little bit? Give it a big breath down into that area. See if you can feel your breath going down into your pelvic floor. So what I want you to think about now is let's get the hamstrings to do the work. So hamstrings insert here on those ischial tuberosities. So think about lifting your ischial tuberosities up toward the ceiling, not bending your knee more. So instead of it being a knee drive up, it's a hip drive. And then I want you to hold that for me. And I want you to focus on where you're feeling it now. Are you starting to feel more going on in this proximal hamstring area. So just keep holding it until you feel something happening, but you should feel a little bit less behind the knee than you felt earlier. And then what I want you to think about is what's happening below that in this glute area, in this deep hip rotator area. Is it soft and squishy? Because remember, we don't want all that compression in from everything contracting at once. We want to get proximal hamstrings going and not anything in those glutes or deep hip rotators. So go ahead and make sure these are super squishy down in here, and make sure you have found those hamstrings. All right, so that is step one. Find the hamstrings, let the glutes go, and you can just hold this and breathe if you want. But this in and of itself is the first starting point for us to be able to decrease that pelvic floor tension. Now, I'd like to turn our attention more to a direct pelvic floor contraction and more lower ab focus. So if you'll join me up in the chair, then we'll go through that together. Now that we've started freeing the sacrum and the posterior pelvic floor a little bit, I want to talk about how you're contracting the pelvic floor. And I want to talk about the muscle and tension component of that. So when we think about contracting our pelvic floor, we can just gangbusters contract everything. But where we lead the way, much like our proximal versus distal hamstring, is going to change the kinetic chain that gets involved with the pelvic floor specifically. So let's take a look at that. When we initiate our contraction more from these posterior superficial pelvic floor muscles, so the pelvic floor muscles that you can touch, the ones right here near the surface, so when we initiate from the back, we're going to have a kinetic chain approach that gets more glutes, more deep hip rotators, more obturator internus, more things that perpetuate that posterior tightness. Now, when we pull tension and we contract primarily from the back of our pelvic floor, that can increase leaking from the front of our pelvic floor because we might not be gathering a good front pelvic floor contraction. And so if we think about initiating a contraction from the front of our pelvic floor, then that is going to give us a kinetic chain effect that comes up through our lower abdominals. All right, so then we're getting more lower abs. So let's try that together. All right, so find a comfy spot for me so that you can relax and lean back a little bit. And what I want you to think about doing is I want you to think about, go ahead and clench your glutes for me and think about squeezing right around your anus and give me a back pelvic floor contraction all the way, just as hard as you can. Okay, do you feel how you got a little lower abs, but you got a lot of glutes with that? Now, relax that out. Maybe open your feet a little bit. So open those feet, bring your knees in, feet out to really lever open the back of the pelvic floor. Now, sitting in that position, what I want you to think about is place your hand right on your pubic bone. So place your hand right on your pubic bone. And I want you to think about contracting the front of your pelvic floor. So you're going to think about doing like a clitoral nod. So you're literally gathering the front of those pelvic floor muscles first. So go really subtle. This is going to be your first 10% of your contraction. You are relaxed. All right, so the reason I'm facing this way is because I want to show you that kinetic chain approach. So if I start with the front of my pelvic floor, if I relax here and I start with the front of my pelvic floor and I think contract front pelvic floor, front pelvic floor, front pelvic floor, you can see how as I turn that into a kinetic chain contraction, I could go all the way up with my abs, and you see how I can get more lower abs, and I can actually leave my upper abs relaxed. So for all you upper ab grippers out there, it is possible to contract your lower abs and keep your upper abs relaxed. You don't have to cinch down with those upper abs, creating that lower belly pooch, tons of pressure down on your pelvic floor. Okay, ideally we just want everything to contract together, but in a really balanced, nice, even way. Okay, so what I want you to do for me now is take your fingers, place them on your pubic bone. And I want you to think about that gentle front pelvic floor contraction. And then as you contract your pelvic floor more, feel that contraction move up into your lower abdominals and feel that really great lower ab contraction. And you feel less glutes, less obturator, less tension in the back. Now, here is my warning for you. I would say maybe 10 to 15% of the women that I see have front pelvic floor tightness. And then what was that, like 85, 90% of the people I see have posterior pelvic floor tightness. So I'm making this video to address those with posterior pelvic floor tightness. And because of that, they're getting poor lower ab contraction, and they're getting poor front pelvic floor contraction, and they might be suffering from leaking and all the things that go along with that. Deep hip rotator pain, deep butt pain, obturator, internus pain. So we are helping with decreasing that tightness. Now, if you have front pelvic floor tightness, what is front pelvic floor tightness? Well, front pelvic floor tightness would maybe go hand in hand with something like interstitial cystitis. You may feel like you have a UTI when you keep going in and your UTI test is negative for bacteria, but you're like, why does it feel like you have a UTI? Why does peeing burn a little bit? That would be front pelvic floor tightness. So if you have front pelvic floor tightness, please do not do this. You can do the first exercise. You can try it once and you'll probably be fine, but don't do it repeatedly as an exercise. You can do the first exercise we did where you find those hamstrings, help free that tailbone. That would be very helpful for front pelvic floor tightness as well. But I don't want you to do these purposeful front pelvic floor contractions, because that's like taking something that's tight and making it tighter, and it will potentially aggravate front pelvic floor tightness and make it worse. All right, but for those of you that tend to have a little bit more posterior pelvic floor tightness, which is more common, I want you to work on keeping the back of your pelvic floor as relaxed as possible, initiating the contraction for the front. The whole pelvic floor will gather and lift, but what you're thinking about is that first 10% of that contraction. So you want to gather that front pelvic floor, and you want that kinetic chain to be all lower abs. So feel that front pelvic floor come engaged. Slowly lift that front pelvic floor. All the pelvic floor joins in, and then really increase that lower ab contraction. So you should feel the difference between initiating from the back, lots of glutes, lots of deep hip rotators, and initiating from the front, lots of lower abs to help that pelvic floor. So how we initiate a contraction, the muscle intention that we bring, the timing that we have trained our body to utilize will change the whole dynamics of how the pelvic floor is contracting, how the lower abs are contracting, what our go-to muscles are for our body. And then once we change those go-to muscles, then we have our changes in everyday life. And then it's amazing how fast you can get changes in the body if you change the movement habits and patterns of everyday life.